Ruth was 72, and for 3 months she'd been quietly horrified by her own ankles. Every evening they puffed up, both of them, until the skin felt tight and shiny, and her sock left a deep red ring that stayed for an hour after she took it off. She pressed a thumb into the swelling one night and watched the dent stay there, like a fingerprint in soft dough, before it slowly filled back in. She was certain it was her heart. She'd read that swollen ankles meant heart failure, and she spent 12 weeks bracing for the worst, sleeping badly, afraid to mention it in case saying it out loud made it real. When she finally told her doctor, the answer took about 90 seconds to land, and it was not her heart at all. It was a pill, one of the most commonly prescribed blood pressure pills in the world, a pill she had been taking faithfully, exactly as directed, for almost a year. Nobody had ever told her that puffy ankles were one of its best-known side effects. So she'd spent 3 months terrified of the wrong thing. Hello and welcome back. I'm Dr. Goodman, and the whole point of this channel is to hand you the information that usually stays locked behind the clinic door. Today, we need to talk about a connection that millions of people over 65 are living with and have never had explained to them. The link between a certain kind of blood pressure medication and swelling in the legs, ankles, and feet. By the end of this video, you'll understand exactly why it happens, how to tell this kind of swelling apart from the more serious kind, and the precise conversation to have with your doctor about it. Ruth is a composite patient, like all the stories I share. But the medicine is real and well documented, and I'll point you to where you can read it yourself. But before we go 1 inch further, I need to say the single most important sentence in this entire video, and I need you to take it seriously. Do not stop taking your blood pressure medication. Not today, not because of this video, not without talking to the doctor who prescribed it. Blood pressure medication is preventing strokes and heart attacks every single day, and stopping it suddenly can be far more dangerous than any swollen ankle. This video is here to make you informed so you can have a better conversation, not so you can make a change on your own. Are we clear on that? Good. Now let's understand what's actually happening. The class of medication we're talking about is called a calcium channel blocker. You may not know the category name, but an enormous number of people over 65 are on one of them. They work, and they work well. They relax and widen your blood vessels, which lowers your blood pressure, and that's a genuinely good thing. But here's the part that rarely gets explained at the pharmacy counter. These medications widen the small arteries, the ones carrying blood into your tissues, more than they widen the small veins, the ones carrying blood back out. Picture a sink where you've opened the faucet wider, but the drain stayed the same size. More fluid flows in than flows out, and the pressure pushes a little watery fluid out of the tiny vessels and into the surrounding tissue. Gravity pulls all of that fluid downward into the lowest parts of your body. And for someone on their feet during the day, that means the ankles, the feet, the lower legs. That's the swelling. Doctors call it peripheral edema, and with this family of drugs, it's not rare or mysterious. It's expected. Studies of these medications have documented this swelling in a meaningful share of patients, and the higher the dose, the more common it tends to be. So if you're on a blood pressure pill and your ankles have started puffing up, especially in the evening, especially in warm weather, especially the higher your dose has been pushed, there is a very real chance this is the explanation. And I want you to notice the relief in that, because fluid pooling from a blood vessel medication is a very different animal from the frightening causes Ruth lay awake imagining. If this is already clearing something up for you, do me a quick favor and hit the like button, because it helps me get this in front of more people who've been worrying about the wrong thing. And if your ankles have been swelling and nobody ever told you it could be your medication, type the word ankles in the comments. I read them, and I genuinely want to know how many of you this describes. Now, this is the part that matters most, so stay with me. Not all leg swelling is harmless medication swelling, and you must know how to tell the difference. So let me give you the warning signs that mean your swelling needs urgent attention, not a calm conversation at your next appointment. First, if the swelling is in one leg only, not both, medication swelling is almost always symmetrical, both ankles evenly. Swelling in a single leg, especially if that leg is also warm, red, or painful, can signal a blood clot. And that is an emergency. Do not wait on that one. Second, if the swelling comes on suddenly and is paired with shortness of breath, especially when you lie down flat, or you find yourself needing extra pillows just to breathe at night, that combination points toward the heart or lungs, and it needs same-day attention. Third, if you're also gaining weight quickly over a few days, several pounds of it, because rapid weight gain is fluid, and fluid building up that fast is a signal the body is struggling to keep up. That deserves a prompt call. And fourth, if the skin over the swelling breaks down, weeps fluid, develops sores, or the puffiness climbs well up past the ankle into the thigh, that's swelling that has gone beyond a nuisance and needs to be looked at. So burn this distinction into your memory. Both ankles, gradually, worse in the evening, better after a night's sleep with your legs up, and otherwise feeling fine. That pattern fits medication swelling, and it's a conversation. One leg, or sudden, or with breathlessness, or with chest discomfort, or with fast weight gain. That's not a conversation, that's a phone call. Today, let's say your swelling fits the calm, both sides medication pattern. What do you actually do? Here are the 3 steps in order. Step 1. And I'll say it a third time because it's that important. Do not stop or change your medication on your own. Keep taking it exactly as prescribed until you've spoken with your doctor. Step 2. Book a regular appointment, and when you go, describe the pattern precisely. Say, both my ankles have been swelling. It's worse in the evening and better in the morning. It started after I began this medication, or after my dose went up. Those specifics let your doctor connect the dots fast, the way Ruth's did in 90 seconds. And here's a question you're allowed to ask, gently and respectfully. Could this swelling be a side effect of my blood pressure medication? And if so, are there options? Because there often are. Sometimes a doctor can adjust the dose. Sometimes there's a different medication in a different family that doesn't cause this. Sometimes adding a second medication actually balances it out. Sometimes, after weighing everything, your doctor decides the medication is doing its job so well that a little evening swelling is a fair trade. And that is a perfectly valid medical decision. The point is that it becomes a decision made together, with eyes open, instead of a mystery you suffer in silence. Step 3. In the meantime, there are gentle, harmless things that help fluid drain out of your legs, and none of them involve touching your pills. Elevate your legs above the level of your heart for 20 or 30 minutes in the evening. Propping them on pillows while you watch television works beautifully. Move regularly through the day because the muscles in your calves act like a pump that pushes fluid back up out of your legs. Even standing up and walking to the kitchen every hour helps. And many people find that properly fitted compression stockings, the kind a pharmacist can help you size, make a real difference. These are comfort measures, they're safe, and they don't interfere with the work your medication is doing. Now, let me be honest with you about the boundaries of all this, because honesty is the whole reason this channel exists. I am not telling you your medication is bad. Calcium channel blockers prevent strokes and heart attacks, and they are for millions of people exactly the right choice. I am not telling you that your swelling is definitely the medication, because it could be one of those other causes we talked about, which is precisely why your doctor, not a video, makes that call. What I am telling you is that this connection is real, it's common, it's well documented, and far too many people over 65 are quietly frightened by their own ankles for months because nobody ever explained it to them. You don't have to be one of them anymore. Ruth went back to her doctor with the right words, and within a few weeks, a small adjustment had her ankles back to normal and her blood pressure still beautifully controlled. 3 months of fear, undone by one informed conversation. That's all this is meant to give you, the words to walk in and have that conversation. If this helped, subscribe and ring the bell, because next I'm going to break down the warning signs that your blood pressure is actually too low, which sounds impossible until you realize how often it happens to people over 65 and how dangerous it can be. It's the natural next piece of this story. I'll see you there. Take care of yourself. Look after those legs. And remember, the goal is never to fear your medicine. The goal is to understand it.